Love it. Well, good evening. And I know all of you, but I will still introduce myself for those online. My name is Tara Ewing, and I am the health director at Three Rivers Public Health Department. And we are very thankful that you are joining us this evening. I also have with me Dr. Nicole Akers. So thank you very much for putting together this terrific presentation. We are here to talk to you about something that most people thought was a thing of the past, and that is that of the measles. Unfortunately, it's back.
I don't use that. That's use my mouse for that. Yeah.
Okay, there we go. So why are we talking about measles right now? Well, as of today, there are over 1,000 cases that have been reported in the US alone this year, and those 1,000 cases or over 1,000 cases actually are in 31 different states here within the US. We also know that measles is one of the very most contagious viruses that we know of. I'm going to let Dr. Akers now talk a little bit about measles.
Yes, hello, I'm Nicole Akers. I'm a physician at Saunders Medical Center. So I'm one of the family docs that you might see in the clinic or in the ER if you happen to come in. And we thought it would be important to do a little talk about measles for the community just because we've already been getting a lot of questions. Just since there are cases in surrounding states, it's kind of all around us as we'll talk about. But we thought it would be good to educate about what measles is and how we can help protect ourselves from it. So measles is a viral illness and it is very contagious. It will spread by droplets. So that can be through direct droplets with someone speaking to you, if they cough, sneeze on you, but it can stay alive even on surfaces. And so we'll talk through that as far as like prevention and making sure surfaces get cleaned efficiently after someone with possible measles has been in a room. And how it will present, and we'll go into this in a little more detail, is it's going to present with kind of those general viral symptoms. And what makes it difficult to distinguish this between other viruses is because it can overlap so much. One thing that we'll talk about is the rash is kind of one differentiating factor, and then the timeline of symptoms, but it will have fever, fatigue, you'll have some runny nose, redness of the eyes, what we call conjunctivitis, and then a rash. The other name you may see on some sources is rubeola, and that might even be what's on your immunization card, because that is, I know what on several different older immunization cards, it will still have that old nomenclature, but more the common term I would say is more measles is what you're used to hearing. So as far as stages of infection, we divide it into 4 different stages. The incubation period, kind of when it's starting to replicate in the body after you've been exposed. Prodrome is those initial set of symptoms, rash and recovery. So as we jump into the incubation, that is when you were exposed from those droplets from someone that was infected till the time that you develop your symptoms. And as we mentioned, it's going to be transmitted by those respiratory secretions, and the time frame of it starting to build in your system before you actually develop symptoms is a huge range, 6 to 21 days. And that's one of the reasons this becomes so widespread is people often don't realize that they're starting to develop this viral syndrome, and it can kind of be a slow going process at the beginning. And so then they could potentially be spreading it to others at risk and not realize it. So that's what makes it kind of tricky to contain. As far as the prodrome, that's about 2 to 4 days, and that's what we were mentioning, the typical viral type symptoms such as fever, fatigue, runny nose, redness of the eyes. An interesting thing that isn't very common, I mean, it's hard to actually capture this particular exam finding, but if someone were to have these particular spots on the inside of their mouth, that is something called the Koplik spots. And it's more of like a buzzword for us providers to look for inside their mouth, because then that really helps tip us off that, hey, maybe this virus is actually measles virus and not a different type of virus, but it doesn't have to be present. So someone can certainly still have measles even without those spots on the inner cheek. But that's something to tip us off that we need to do some more investigating and potentially further testing if we see that. And the other next stage is that exanthem, or that just means rash. So you might see exanthem when you're looking up symptoms of measles. The key with this one is the distribution. So we'll start more on the face and then move down. It starts face, moves down the rest of the body, and it kind of starts on the front and then wraps around to the back. Whereas a lot of other viruses I tend to see in my office to typically kind of diffusely pop up just all over the arms, trunk, legs. It doesn't involve the palms and the soles. There's very few rashes that typically will do that. So this does not go on the palms or the soles. But what will be interesting is that eventually, as this rash spreads from head down to towards the feet and then around towards the back, it oftentimes will actually darken and then your skin will kind of slough off, something we call desquamation. It's basically as the body's healing and recovering from that rash, it can start to peel off. Think of like a snake, but in little pieces, right? All right, and then recovery. So we get to the lovely recovery stage, which you think, oh, great, we're recovering, we're feeling great. Unfortunately, that darn cough seems to last for a while with these patients. And so it can be even a few weeks. And that unfortunately can happen with other viruses too. But the key is this is kind of the time frame when you might see those complications. I mean, a virus does not require treatment from an antibiotic. There are some other interventions we'll talk about, but this is where you might start to see a secondary pneumonia or some sort of sinus infection or other infection that then is going to develop because that patient's immune system has been weakened by this virus. And we do think, as of our evidence, that if you have measles, then you have like a native infection, not just getting antibodies from the vaccine, you should be protected lifelong. And then Tara added in this nice cartoon here to show you how it's spread. So it's nice, you can see here. I wonder if the pointer, maybe I can do it in here. Oh, there we go. So direct droplet contamination. So because it's such a highly contagious virus, any of those droplets that come out of one contagious or from one person that has it is very contagious to the other person if they're susceptible to it. And then that can be from coughing, sneezing. Some people are big spitters when they talk. And so that can even also lead to the transmission. And then the air droplets we were talking about. And that's what some people don't always think about is that if someone has been infected in, say, an exam room, and then we let them leave, have someone come in following them and don't have all the surfaces decontaminated appropriately, there is potential risk for spreading of the disease that way. And so that's why we have certain protocols in place for anyone that we think might possibly be infected with this virus. And it can spread to others from 4 days before the rash through 4 days after the rash. And like I had mentioned, that rash is kind of our tip off of like, oh, this is probably or could be measles. So that's also what makes it difficult because in that initial prodrome phase, until that rash develops, you may just think you have just a different common cold type virus. And so it can make it tricky because a lot of people understandably are still going to be going to work, still going to school, doing their routine activities if they're feeling up to it and not running a fever necessarily. So how do we diagnose it? There's a few different tests. Right now, what we are doing as far as our protocol is if I have a high suspicion for someone with measles, I will order a blood test. This is checking for antibodies, basically in the blood to see if they have long-term immunity or if it shows that they've had a recent exposure to the virus. And then we specifically will check their respiratory secretions as well as we can check the urine to do a test called a PCR that actually is going to replicate that virus so we know if it's in there or not. And we'd spoken with their infectious disease doctor last week, and that will be even if it's like the cells of the virus are dead by that point. So even if it's a little bit further on in the process, it will still pick up that virus in those secretions. So as I had mentioned, treatment for the virus itself is really more supportive. So, Tylenol or Motrin, your Dayquil, NyQuil, those kind of medications to help with symptom management are going to be helpful. There are some studies out there that I've been reading about with use of vitamin A and specifically antiviral therapy, but that's more like if someone is requiring inpatient hospitalization, that they're that sick from it. So it's not something, fortunately, that I've had to do. We don't have any cases here yet at this point. And I'm hopeful we won't have to use these treatment strategies. Do you want to get someone else to accept them? Yes. So it's something that we'll keep in mind, but I wouldn't suggest everyone go out and stock up on a whole bunch of vitamin A at the pharmacy, okay? That would be for very select patients. There's not great evidence that the general person, if they were to be exposed or diagnosed with measles, necessarily needs it. That could change. We're always learning new things, so that might change as time progresses. And then if those complications develop, like I had discussed, such as a pneumonia or sinus infection, then we would treat appropriately depending on what the patient has as a complication. And then the isolation, that's the key, is we really want to try to isolate for 4 days after the onset of the rash, because as we had talked about, that patient is still contagious through those 4 days after that rash first appears. Now, there is something called post-exposure prevention. The tricky thing, as Tara and I were talking about, is knowing that you were exposed is a little hard because it takes time for someone's test to come back. And then by the time that that comes back, the people that were exposed to them, they'd have to fall into this perfect little window of time. And so it's probably not super feasible that this will really happen, but there are those options for the right scenario. And that's something you would coordinate if you had an exposure with your doctor and figuring out the timeline and figuring out if you're at risk or not. So some people may benefit from an MMR vaccine post exposure, but it has to be within 72 hours, or something called an immunoglobulin. And so this is someone that's like high, that is very high risk, that is on immunosuppressive therapy, such as they have an autoimmune condition like rheumatoid arthritis, and they're on medication that really knocks down their immune system. They may need that immunoglobulin because they shouldn't be receiving live virus vaccines, which the MMR vaccine is, or someone on chemotherapy. That's another patient population that sometimes does benefit from the immunoglobulin. And then how do we prevent, right? We all want to avoid getting sick as best we can. So the MMR vaccine, and this is measles, mumps, rubella is what it stands for. And it's given pretty much standard now at your 1 year, so 12-month visit, and then kindergarten. The kindergarten is technically anywhere from 4 to 6 years of age. Patients are eligible as young as 4. And just with the one shot, you get approximately 93% effectiveness. And then the second shot bumps it up to that 97% is what our current data is estimating. And then you can give it early. I've been having this question a lot. So from the research we have found, it is safe, completely safe to give it as young as 6 months. I just never will guarantee payment, at least at our current facility. That's how most offices are saying the same thing. We don't know if insurance will cover it or not. It might get covered if, say, our state is under like a big outbreak, then insurances might say, hey, let's be nice and cover this for our babies that are at risk. But as we all know, that's a big game and not a likely battle we will win. But it's great that we have that as an option to protect those little babies, because those are the ones that are really high risk because they have no protection and their immune systems are already so weak. And then as far as individuals that have not had a prior MMR vaccine, or measles infection, they can then get the MMR vaccine. But again, they have to be able to get a live virus vaccine. So it cannot be a pregnant woman and cannot be someone on immunosuppression therapy because they're not able to get a live virus vaccine. And so who needs it? This is also another question we get a lot. We just had this before we started this meeting. If you were born before 1957, you are okay. You didn't generally considered to be immune. So you really don't need to stress a whole lot. I've had some patients that have voluntarily chosen to get the MMR vaccine as like a booster. Again, I can't guarantee that it will be covered with insurance, but I don't think you're going to cause harm. It just might help. You might have some of those mild vaccine type symptoms that you get with like a little ickiness in your arm or a little bit of a runny nose. But we haven't seen any adverse outcome, even if you did have 2 prior shots. You can also check your titers directly in the blood to know for sure what your protection is against the virus. And if you only have had 1 dose, it is recommended to go ahead and get that second dose. So this is something that's come up a lot, especially with healthcare workers, is showing, do you have the 2 dose series, just because healthcare workers likely would be the ones that might interact with these types of patients. And so making sure they're as protected as possible is something that we definitely have been in talks of with our facility, but you can get a booster of it if you've only had the one. And then where are we at in the United States with this lovely virus? So, as of May 15th, because it comes out every Thursday, so I didn't see updated numbers as of today, but as of a week ago, there were just over 1,000 confirmed cases. And as you saw on the map is a little bit easier than all the it listed out, but there's 31 different areas that we've seen it, 31 different jurisdictions, but this breaks it down to New York City and New York State. But pretty much all around us. We haven't had any confirmed cases in Nebraska though. So looking at our total cases, it just is nice to kind of see how the breakdown is as far as you can see the distribution of it is pretty evenly spread amongst the different populations. But a lot of this, if you think of it, it makes sense that since under one can't be vaccinated yet, and then those that are, which if they did would be just like 1%, they might not have a second dose yet. But this is kind of the key takeaway is that it's definitely if you have your MMR shots, like if you've had prior protection, we're seeing that it holds up with the outbreak, that the people that are being diagnosed currently in 2025, majority are going to be unvaccinated, I should say. And then hospitalizations, just looking at the breakdown there. Unfortunately, I mean, we all know that that's how news is. They kind of make a big deal of things and bring everything to light. But and it is something that we had previously technically said we had eradicated, and so that's why it's become such a big deal. But in the grand scheme of things, let's keep it in perspective. I don't want you to not feel like you can live your lives. We just need to protect ourselves if we can or if we need to. And so we want to be careful to avoid, especially those people that are very high risk that are unvaccinated, especially the little ones under one is the tough thing. Because if we do continue to see this spread, we're going to see more and more little ones or immunosuppressed patients that really suffer the consequences. Because you can see here, this is what we're saying, how it was at one point was considered eradicated in the United States, and now we see such a big uptick in it. We're not going to get into like pro or anti-vaccine. That's not the goal. This talk is just to educate you about measles, but we do see that that is where majority of the cases live. That's all the facts are, is that it's usually the people that are unvaccinated is where we see the infection rates coming from. So that just kind of tells you in the numbers, kind of. And then questions, but I'll let Tara jump in too if she has anything else.
So there's just a couple of things that I want to emphasize.
Any specific slide you'd like me to go to?
Nope,
Yeah.
you can just stay there. It's not about fear. It's just making sure people can protect their families, make the decisions, that are right for them. So I've actually been getting quite a few questions. The first question is, and you might find this one interesting. So yes, a baby as young as 6 months can get their first dose of MMR. If they do get that first dose of MMR before 12 months, it does not count towards the 2.
Correct, yes.
And so that's where, like I had a call last week, especially if people are going to be traveling internationally, we're saying, okay, go check with your healthcare provider. And that's something, that you might want to do. The other thing is we were actually just at a conference in San Antonio, the kind of the epicenter, there in Texas. And they went on to say too, that now with the travel, people are just traveling the corridor. And it really is to unvaccinated individuals that, that's spreading. So just, of course, if you are traveling, just take precautions too, to make sure that you can protect yourself as much as you can. We also have like 3 top questions that a lot of the different health departments are getting. And the first one was, didn't we eliminate measles? And back to what Dr. Akers just said, yes, we had. Well, why is it back? Well, it's because international travels, especially to countries that might not have vaccine. It also is because one infected person can spread it up to 18 people because it's so highly contagious. And the other one is some communities just have lower vaccination rates. So that's why I actually had this conversation with somebody here 2 weeks ago, and they had a really hard time understanding that. The other question, and I think I just want to reemphasize this, who's at greatest risk? Those little kids that haven't been able to be vaccinated, those that are immunocompromised, and especially pregnant individuals. And then the other thing, they're like, well, what do I need to do? Do I need to go get a shot? No, if you've had your 2 shots,
You're fine.
you know, you're fine. But just make sure you and your family are vaccinated. That's the 2 doses of the MMR, which is the 97% effective. And unsure, I like to say, then talk to your healthcare provider because they can give guidance there. Lots of questions. And the good thing is, I will say on the measles call this week too, you know, some of those numbers are starting to plateau just a little bit. So are we going to see a little bit of just a drop off now? And then are we going to start to see it again before school?
Yeah.
You know,
Or
so
when the weather starts turning, yeah.
yes. So we'll be working with schools, working with providers just to make sure that everybody is knowledgeable and has what they need. That's all that I have to offer.
The one thing I did want to mention, just because I like to give this guidance to my families when I do have, because I have a lot of pediatric patients, the MMR vaccine is one, it is a live virus. So I always am cautious, like if you do have like a grandparent or someone that is immunocompromised, be cautious with them, even like changing baby's diaper and being in close proximity for those first initial days after baby gets that shot. And it can cause a fairly high fever. I've seen up to like 103, and that can be even for a few days post the shot. So just know if you do decide to get a booster and you have that reaction, that is something we see. Always talk to your healthcare provider if you're worried that you're having an adverse reaction, but just know a higher fever than some other shots isn't uncommon with the MMR one. So just to be aware of that. Yeah.
I have a question. So, say your baby, has already had one of the vaccines, how much time between before they can have that second?
So the question is how much time between shots if you have a baby that's had at least one dose of the MMR? And from what I read, it was a minimum 6 months. Is that what you guys are telling from the health department?
That's what we're saying.
Yep, yep. And so health department, and what I've seen in my review of the literature is we want to wait at least 6 months ideally. But it is a good point that Tara brought up that if you do decide to do that early dose for your kiddos, they say they're 6 months, or your 3-year-old want to do their kindergarten shot early, that's completely fine to do. Again, and we don't know if it will be covered from like an insurance perspective, but we would still then recommend at their routine checkup for the standard guidance with the immunization schedule, still do it at that time too.
Do you have any idea how much getting the vaccination costs if it's not covered by insurance?
So I know each facility is a little bit different. I think ballpark is about 200, we think, out of pocket. If it like, I think that's about how much it costs most places to order it. And so they just do like cash price for it. I don't know if the health department would be a cheaper price.
So we don't
You don't
offer
have
that.
it?
Well,
Can-
the board approved it, so if there's a need, we can offer it.
Okay.
But we have it just in VFC for vaccinating our children. And I think our price was $138.
Yeah.
And but we don't actually have private in stock.
Yeah.
Because I'm like, if the doctor's offices, physicians, pharmacies can do it, but if we start seeing,
Yeah.
we need people to come in, then we can do it.
So I would say anticipate 130 to 200
Yeah.
roughly would be a good estimate depending on location.
For that, 4% or 3% of vaccinated people that that do get infected, are their symptoms less severe generally?
From what I've read, yes, it's sometimes a little bit more atypical, not quite all of the classic symptoms that you see. From what I have read, is it does seem to be a little bit less severe.
The other, and you guys have seen this too. Unfortunately, there's been 3 deaths, here in the United States since this outbreak has started. And 2 of them were children, and one was an adult. So when we were in San Antonio here, end of April, first week of May, we actually had one of the states. So they actually did a measles this is what we're seeing, and it was 4 states. And what they learned, and what they were going through, I hadn't even given some thought to. So it was really interesting how they were seeing, but they really reemphasized that it was vaccinated individuals that were, they were getting hospitalized.
As we approach the summer months and anticipate maybe that's where the travel is and it coming here, are there certain precautions we should take even if we're taking our kids to the park, to the pool, and all those kind of things?
So the question is what kind of precautions to take if you're gonna be traveling or going to a park and pool. I mean, obviously, if you yourself are sick or your kiddos are sick, be mindful of that and trying to not spread germs as much as you can, especially if you're running a fever, please stay home. Just like school wouldn't want you to come if you've had a fever in the last 24 hours, still kind of follow that general measure. Um, it's one of those tough things because I don't want people to be complete germaphobes and not get outside and play and be stuck in a bubble all summer. But obviously, if there's someone that they are around that seem like, say, on an airplane was very sick, if you can try to take precautions and like make sure to wash your hands, or if you have a mask to put on, if someone next to you is coughing, sneezing all over the place, you can take those measures just as you would for any general virus, is what I would say to do, is just be mindful and trying to, in general, avoid going out when you're really sick and avoid trying to be around people that seem to be real sick.
We live in the air up to 2 hours. And so then that's where, I don't know, thinking about vacation plans and like maybe a car ride doesn't sound too bad.
Right.
Instead of an airplane, but I think just, have hand sanitizer,
Yeah.
watch your surroundings, and then those types of things. The good thing is at least if they're outside, fresh air.
Yeah, yeah. And I think that's where if you are able to be fully protected, then that gives you that peace of mind and reassurance too.
So if I was born in the 70s and I can't find my immunization record, what should I do?
So the question is, if you were born, say in the 70s, so you're not before that timeline cutoff, and you can't find a copy of your immunization records, I would say just check a titer. Because if you do the blood work and check your titer and you know that you have good antibody protection, then you're considered protected. But if you would prefer just to get the shot, because like I said, it is safe to do even if you have had that prior to, that would be a fine option too. Really, both would be considered a good option for you. And most employers, like especially if you work in healthcare, most employers they think that will be offered as part of your risk being in that field. But for other locations, like if someone say they're at a bank and they have a lot of interactions with the general public, but they might not necessarily have that same coverage, that would be a discussion to have with their provider and to see what might be a better option. Because in all honesty, I don't know what the coverage will be like from insurance. So the cost factor might play a role in that because a blood test might be more expensive than just doing the MMR booster.
So would a person just need to get one or would you actually get two?
I've just read just the one is what I've seen. That you
Yes,
get,
it's at 93%.
yeah, yep. Especially because more than likely you do have some sort of protection. And from what I have read, just doing the one additional, like one booster in as an adult is adequate. But that might be the cheaper option if you have no coverage.
And had somebody asked me, what if I don't want to get my titers? I said, well, then you can go get it,
Yeah, go get the booster. Yeah.
And I'm like, well, where can I get that? Your healthcare provider, you can go to a pharmacy, and went through all that too.
Yep. Yeah, well, good question.
So what about if like I have an elderly parent that say I am vaccinated, but then I'm exposed? Like, should I avoid that elderly parent?
I don't know if we have a current policy guideline on that.
That's works again, if you're vaccinated, and you know you have the 2 doses, you're 97%. They don't even ask you to isolate or to be. I would just use an abundance of caution though, like if I knew I had an exposure and you're not sure about them, then I would probably just stay away, just for a little bit. The one thing, and this just made me think of this, if you have somebody that is not vaccinated that has been exposed, they have a 21-day.
Yes.
A 21-day isolation or.
Yes, sorry, we did not mention that yet.
Yes.
So just in case for those online couldn't hear, if someone is unvaccinated or high risk and they are known to be exposed, they need to isolate for 21 days. So that is a different timeline than what we had mentioned in the presentation. So that is a key takeaway.
And it also just kind of goes back to my daughter's pregnant. And if we decide to go somewhere here later in the summer, we'll just make sure we stay away from her when we get back for a little while, just out of an abundance of caution. So just what makes sense for your family, and she works in healthcare. So, I mean, it's just, we'll just do whatever feels right. But since we're vaccinated, or if you're vaccinated, really that protection, is very good.
Yeah, great discussion. Perfect. Well, we will go ahead and save this presentation and then we can post it to like social media outlets so that way people can review it. And obviously things may change as it evolves, but just be aware of it, protect yourself, but still enjoy your life and make sure you're just good at it.
Yes, it's not about fear.
Yes, we
Just
don't
about
want people
being
to stay
ready.
cooped up inside all summer, especially on a gorgeous day like today. All right, thank you so much.